Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking all about Bell's palsy. So let's get into it. So first of all, what is it, right? So it's when your facial muscle either has a weakness or a paralysis. This is sudden and it gets worse over a 48-hour period. So there is some sort of damage to cranial nerve 7, which is your facial nerve. And usually what happens is it becomes inflamed and swollen, and then it doesn't work well. Some common causes are viruses. That's kind of the big one. So this can include a variety of things like herpes, chickenpox, measles, mumps, cytomegalovirus, rubella, shingles, things like that. So that's the number one cause, is a viral infection, but it can be other things too. Localized hemorrhage or trauma or a tumor in that area. This is something that can happen to anybody at any time, so any age, but the people at highest risk are those who are pregnant, especially near the end of their pregnancy, like third trimester or immediately postpartum women. Those who have diabetes, especially if it's uncontrolled diabetes. And then people who have upper respiratory infections, viral infections. That's the number one thing. Now let's talk about the symptoms. When it comes to the signs and symptoms your patient with Bell's palsy will have, there's the obvious one, the ones we think about, but then there's a couple of ones we don't think about that are still very important. So let's talk about those. So the first of which is the patient can report a loss of feeling, a loss of sensation in the face. So if you were doing a cranial nerve assessment, right, and you were to stroke their cheek, they might not be able to notice that. They might not be able to feel that. They can report headaches, disordered movement of the facial muscles. I think this is probably the one we think of when we think of Bell's palsy, is if you ask them to do something like smile or frown, they can't do that. They can have uncontrolled tearing from the eye, the affected side, drooling, and a loss of taste. They can report pain around their jaw or their ear, unable to close the eye on the affected side, which can lead to, trauma and damage and scratching of the eye, which we don't want. And then hypersensitivity to sound on the affected side's ear. Another really big important thing about these signs and symptoms is they get worse before they get better. So within that 48 hours of it being diagnosed, they get a little bit worse before they start to improve. And they really don't start to improve until about 2 weeks. And for some patients, it can take 3 to 6 months to fully resolve. So that's kind of a long time. So we want to make sure that our patients are aware and that we're documenting everything. All of the signs and symptoms are important, not just this one. So how is this one diagnosed? Let's talk about that. Bell's palsy is diagnosed based on the patient's signs and symptoms. The doctor might also order other tests to be done. For example, they might want to do an EMG to see the extent of the nerve damage. They might order blood tests to rule out other causes like Lyme disease. And they might want to do an MRI to see if maybe this is being caused by a tumor. So they might want to do some imaging to see what's going on in there. So our nursing interventions include lots of medications. We're going to give corticosteroids to reduce that inflammation. We might give antivirals like an acyclovir. Analgesics, especially if they're reporting that jaw or ear pain. A big one with these patients is if they can't close their eye, they're at risk for their eye drying out and getting scratched. So eye drops during the day and an eye ointment at nighttime. They might be referred to a physical therapist because if the muscles are being used, right, they'll start to break down, they'll start to atrophy, and we don't want that to happen. So they might get physical therapy. And then the big one here is eye protection, protecting that affected eye. And this can be using things like glasses or goggles during the day and an eye patch at night. The complications of Bell's palsy are permanent nerve damage. Doesn't happen very often, it's rare, but it is a possible complication that this could be permanent. abnormal regrowth of the nerve fibers, and then the big one, partial or even complete blindness. This is usually due to that scratched cornea because eye protection wasn't being used. So that's why this is so important that we teach the patient to cover their eyes, protect their eyes, use those drops, use those ointments, things like that. So that was my video on Bell's palsy. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.